Good morning. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 7 new cases of COVID-19, bringing our total to 103. The total number of deaths related to COVID-19 remains at 1. As of this morning, 3 individuals are hospitalized. Of that, 2 are currently in intensive care. Our numbers indicate that 4 individuals are listed as recovered. Public health investigations are ongoing, and as details are confirmed, our website will be updated. Yesterday, 378 tests were completed at Chatham Provincial Lab, bringing the total to date to 8,914. Today, Public Health is releasing details about an individual case for public health reasons. A staff member at Selkirk Regional Health Centre has tested positive for COVID-19. This individual worked in the health centre's emergency department and medicine ward from March 19th to March 23rd. Public health, occupational health, and infection prevention and control staff are working together to investigate this case and follow up with all identified close contacts, and including staff and patients. Public health will directly contact people who had prolonged close contact with the individual while this individual is symptomatic. These individuals will be required to self-isolate for 14 days from the date of the last exposure and monitor for symptoms. Again, close contacts will be contacted directly by Public Health, and more details on specific dates and times are available on our website. However, people with concerns can call Health Links to speak to a nurse about the situation. The province is suspending classroom learning indefinitely for this school year. This will help us flatten the curve of COVID-19. I know that this can put many difficulties on many families. These decisions aren't made lightly, but these are times that require extraordinary measures. Our social distancing strategies are required in order to reduce the impact of this virus on Manitobans. We need to interrupt the transmission of this virus for the sake of Manitobans. The social distancing strategies are in place now. We have public health orders in place, but we are expecting all Manitobans to follow social distancing, physical distancing at all times. Stay home whenever you can. If you can't stay home, take strict physical distancing strategies. Again, we announce cases to the public. We break it down by health region, but this shouldn't affect any individual's actions. Social distancing, physical distancing needs to be part of every Manitoban's day-to-day activities. Stay home is your best way to protect yourself, the people around you, and our community. This is especially true if you're sick. Stay home if you're ill. We cannot have people transmitting illness in situations like this. Stay home if you're ill. Symptoms of COVID-19 include fever, cough, stuffy nose, sore throat, headache. If you have mild symptoms, stay home. If you're unsure, call Health Links for further advice. I know that these social distancing strategies have put a lot of strain on Manitobans, but they are necessary. And as we mentioned, social distancing is not social isolation. Continue to stay in touch. Continue to reach out, especially to vulnerable groups. This is a time where Manitobans need to be working together, but we need to implement these physical distancing strategies now, and we need to continue them for the near future until we see this curve flattening. Stay home, only go out for necessities such as groceries. If you do, and if you are able to, go alone. The less people out in public, the better. If you're out in public, keep that 2 meters between you and all others. We again are asking all Manitobans to use credible information. Go to our website, manitoba.ca/COVID-19 for up-to-date, credible information. Please do not share unfounded sources of information. This just feeds into fear and anxiety. This is not that time for fear. This is a time for action, though, and many Manitobans have already taken actions to reduce the spread of this virus. All of these social distancing strategies, the suspension of schools, the enhanced public health orders, these are all proof that we are not helpless against this virus. We are not sitting back and waiting for this virus to affect us. We are acting now to limit the impact of this virus on Manitobans, and together we can flatten this curve and minimize the impact of this virus here. So thank you, and I'll turn over to Lynette.
Thank you. I'd like to begin today by highlighting the Front Steps project. The Front Steps project is a phenomenon that photographers around the world are participating in, taking portraits of people while practicing safe social distancing. The purpose of this project is to bring people together when we might feel isolated and to highlight smiling faces as we get through all of this. Here in Winnipeg, there are a number of photographers who are participating in zero contact, 5-minute photo sessions using long-range lenses. In lieu of payment, they are accepting donations to Winnipeg Harvest, who are in serious need of critical items. To date, the project has raised more than $8,000 in the past week for Harvest, as well as several truckloads of non-perishable items. This is a fabulous initiative that is helping people who rely on Harvest while brightening the days of people and their families. So for more information on the initiative and to see more photos, go on social media and use the hashtag the Front Steps Project. Okay, for just operational statistics, our online self-assessment tool yesterday garnered about 9,000 views. And since launching 2 weeks ago, the French and English versions have had a combined 360 views on the web. DynaCare began yesterday calling back negative results for patients, and on Monday alone they contacted 1,300 patients. So thank you very much, DynaCare. As a reminder, if you are a positive lab result, Public Health will call you immediately to give you some orders and support you through that. HealthLinks data will be available in the next day or two. As mentioned, we're just verifying the data, and once that's done, we'll be able to share volumes and wait times. A new drive-through testing site is opening later this week in North Winnipeg. Also, another Manitoba Public Insurance Service Center on Main Street. And we'll have more details later this week on the hours of operation, but this is the third MPI center to generously provide us this space, so we're very grateful and thankful for that. As a reminder, the community testing sites are not walk-in clinics. A referral is necessary to go there. I also just wanted to highlight that we are putting out a call out now for, we need an increased number of nurses who have critical care experience in the coming days and weeks as we continue to prepare for COVID-19. So specifically, we are looking at registered nurses or LPNs, but mostly registered nurses with previous adult or pediatric critical care experience that may be willing to pick up additional shifts or be reassigned from their current unit into the intensive care unit. We're also looking for nurses with previous adult or child pediatric critical care experience that may be willing to be redeployed to a different site. And we are also looking for nurses and other healthcare professionals who are certified or who have experience in occupational health safety. For our nurses, any additional support that you may be able to contribute to either of these areas will be greatly appreciated, no matter how big or small. And if you're interested in any of these positions, you can email us at covid19recruitment@sharedhealthmb.ca. The other thing I wanted to mention was supplies. So yesterday, I spoke about the requirements and the challenges that we face on a daily basis and require swift action and constant contingency planning. So we are well stocked at this time for weeks to come, but we must continue to take every step necessary to prepare for this virus and looking at how it's impacted other healthcare systems in the world. So we are asking any company who has medical supplies, please step forward and help your community. These supplies may be N95 respirators, medical procedure masks, medical examination gloves, disposable isolation gowns, disinfectants, and cleaners. All supplies have to be in their original packaging. And we have drop-off locations in Winnipeg, Brandon, Selkirk, Portage la Prairie, Winkler, Steinbach, and we are in the process of setting one up in northern Manitoba as well. Addresses and hours of operation for each location can be found online at sharedhealthmb.ca. And Manitobans can also call 1-833-408-0101 if they have any questions or if they need to arrange for pickup. We can help with that. Working together is how our province will get through this, and so we're very grateful for any company who's able to provide us with these donations. And finally, last thing, we know that COVID-19 has changed the way we have lived our lives in the past, and we know it's not going to last forever, but what hasn't changed and what's an immediate need right now is that we need to support nonprofit organizations and charities. Donations for these organizations are needed now, particularly for those vulnerable Manitobans in need. So I'd like to just highlight two worthy causes today. The Adult Clothing Depot at HSC Winnipeg is in need of donations, and they are asking for donations of new clothing, including men and women's underwear, shoes, spring jackets, and comfortable casual clothes such as hoodies and sweatshirts and sweatpants and jeans. They're also asking for any gift cards or donations to HSC volunteer services. So if you can help out, you can email us at community@sharedhealthmb.ca. Similarly, Siloam Mission has temporarily suspended its clothing depot due to COVID-19. However, they still are in need of the following products: shampoo, conditioner, soap, deodorant, surgical masks, examination gloves, thermometer, prong covers, and hand sanitizer. So if you can help out Siloam Mission and the people they serve, please go online to siloam.ca to do so. And these are just two of dozen of worthy organizations who need help right now across our province. So we are all in this together, and we appreciate anything you can do to support these worthy causes and Manitobans every day. So with that, we can open it up to questions.
Thank you. Just a reminder, each reporter is allowed a primary question and then a follow-up. And reporters, please introduce yourselves before you ask your question. First up from the Brandon Sun, Bud.
Hello. Yes, regarding provincial correctional institutions, can you tell me if you are testing at these sites, and if so, can you give me an indication of numbers of tests and any results?
Certainly, they are eligible to be testing, but it would be within justice on whether they are testing or not. So I don't have any numbers specifically related to that, but our testing criteria, certainly anyone with a respiratory illness within the corrections facility could be tested for COVID-19.
Okay. Can you speak to visitations if they're locked down or if they're still allowing visitations of some sort?
At corrections, I can't speak specifically. I'm quite certain there's limitations on it. I don't know the specifics of it, but they've been involved, through the IMS structure and all the government approach early on.
Okay, thank you very much.
From 1029 CHTM, Navi.
Good afternoon, Navi Ball with CHTM. My question is for Lynette. With the province's announcement this morning about in-class learning being suspended for the rest of the school year, you mentioned before that this could potentially open up for self-isolation units. Is that something that the province is now pushing a bit more now that there is that uncertainty as to how long this will go on, or even using them as testing sites?
Yeah, I think, Navi, those are all parts of our planning. So as we continue to build up acute care and we are looking at expanding testing sites, we are looking at safe places for isolation, self-isolation if it's not possible in the home environment. So yeah, they are all related for sure.
And I'm not sure who to direct this question to, but we have had reports about a patient who tested positive for COVID-19 that's receiving negative feedback on social media or on their phone. What sort of resources are available for patients who may be receiving these negative messages?
Well, I don't know about specifically how to deal with the negative messages. I think that there's a number of the certain mental health resources that are available to individuals. But I think this is just a reminder that, this is a time that Manitobans, we need to be together in this. And anyone who is, affected by this condition, we need to have empathy and we need to support each other, not to turn on each other. And so, fear, stigma, these are a virus's allies, right? And so we need to come together, don't turn on each other, credible information, and try to support people rather than turn on people.
Thank you.
From the Winnipeg Sun, Josh.
Hi, this is Josh Aldridge from the Winnipeg Sun. My question is from this morning's press conference. Last several days, we've been asking about the schools and if they would be closing longer, and you've been saying we're monitoring the situation, nothing's off the table. What was the tipping point to make the decision today to close them indefinitely? I know there's been a couple cases now of kids under 10 who have COVID-19 or tested positive for COVID-19. Are we now seeing that community transmission where that's now the concern?
That wasn't specifically in there, and so these decisions are made over a period of time. So it's not made in a matter of hours. We're thinking these things out, looking at the transmission dynamics in other areas, and it just became clear that in the next few weeks, the next month, we're not going to be out of this. So it's going to be very unlikely that we'd be able to open up the schools with much left of the school year. And so that's why the indefinite term was mentioned right now. We're still going to monitor it. If we do see that trend, that it becomes safe, then that's something we could look at. But these decisions are made over time, looking at a bunch of evidence. And so I wouldn't say there's any one thing that happened today that led to that.
Okay, and just a question about the Selkirk Medical Centre staff member who has tested positive for COVID-19. Are they the first medical professional in Manitoba to test positive? And is there any idea how many people they may potentially come in contact with?
Yeah, I can't comment specifically on other healthcare professionals. Like I've been mentioning, we will make announcements like this when it's relevant to the health of the public. So you could see an individual who is in an infectious period for days, even though most of the professionals there think they are going to be able to contact each and every person who had close contact with them. We felt that such a long time frame of infection, we better announce it publicly so that people who may be concerned could still reach out with it. So, but you can imagine that an infectious period over those number of days, it will be quite a few contacts. I don't have the specific numbers, but that would include staff as well as other clients. So that's why we decided to make this announcement.
Thank you.
From CBC Radio Canada, Patrick.
Hi, bonjour. Patrick Foucault from Radio Canada. I had a quick question. We have a lot of, we see tutorials online of people showing how you can make your own mask and your own, facial mask. And so what would you have to say to these people? Is it safe to make your own homemade mask to prevent coronavirus?
Yeah, I'd advise against that. For one, wearing masks by the general public is not useful. I don't recommend that anyway. If you're really concerned about acquiring COVID, stay home. That's what the advice is to everyone. Stay home as much as you can. If you have to go out, practice good social distancing, but I don't recommend any type of mask for just the general public walking in the public. Homemade masks, they're not certified. They may not be made out of the proper material, proper fit, so they may give you the false sense of security anyways. So I wouldn't suggest to make your own mask, and really I wouldn't advise anyone to wear a mask in public if they're not showing symptoms. If you're really concerned, do whatever you can to stay home and practice strict social distancing.
Thank you. And maybe another question on the announcement, the suspension of classes this morning. Just to make sure, are we talking about both public and private schools? We're really talking about all the schools?
Yeah, that's probably best for education to answer. Our recommendation my recommendation would be for all schools. I don't know the exact nature of how that works, but we're trying to enhance our social distancing, limit the amount of groups gathering, and so that would be the effect, the desired effect that I would want.
Okay, thank you.
From CBC Manitoba, Bartley.
Dr. Roussin, Mr. Augusta, Bartley Keepister at CBC. In addition to the Selkirk incident that you have publicized today, we have a story up on our website about a nurse in Winnipeg who believes she contracted COVID-19 from a patient. The Manitoba Nurses Union has confirmed this incident. We've stated there was a healthcare worker before. We've also unconfirmed reports about a diagnostics department at St. Boniface sent home to self-isolate, an unconfirmed report about the Northwest Health Clinic with 6 doctors and nurses showing symptoms. What can you state about the transmission of COVID-19 within the healthcare system right now? Can you confirm these 3 additional incidents at the Winnipeg Hospital, Northwest Health Clinic, and St. Boniface Hospital?
So right now, I'm not going to confirm any specifics. We know how this virus is transmitted and the personal protective equipment that is required. We know in other jurisdictions throughout the world, there is unfortunately transmission that can take place in healthcare settings, and that's why we have as many protocols as we can to protect our staff, which is one of our biggest priorities. And then, of course, when we see an event like we announced today, where there's a large number of people potentially in contact, where our contact investigation may not be complete, then we'll specifically announce those type of issues.
And I
Okay, as a follow-up, in the incident involving Winnipeg, the Manitoba Nurses Union continues to insist upon more protective equipment. You've stated in the past N95s are only needed when there's aerosolized COVID-19 due to medical procedures being done. What additional steps, if either of you can answer, are being taken to prevent healthcare workers from getting infected with COVID-19 and then potentially passing that on to patients and the public at large by extension?
So based on the evidence, Bartley, what we understand, as well as our clinical experts, who some of them are global leaders, is that the most important thing we can do is to practice social distancing, wash our hands often, stay home when we're sick, and wear the required PPE that's appropriate for that situation, which in most cases is contact and droplet precautions. So we will make sure that's available. And what I would say to staff is that we have information on the website that you're welcome to. Really important, the donning and doffing of the personal protective equipment. And if you can't find what you're looking for, or if you have any questions, please speak to your manager or whoever your direct report is, because we want you to have that information and we want you to feel secure that you have what you need.
You mentioned the 4 hospitals in total here. You've publicized one. I realize there might be a data lag getting to you folks, but can you assure the public that the healthcare system is being protected?
Yeah, we have adequate levels of personal protective equipment. We have policies in place to protect against the transmission. And again, it's multifaceted, right? It starts with getting the knowledge out about social distancing, staying home when you're ill, washing your hands. We've diverted the testing, a large number of tests away from our acute care facilities. So there's a lot of things in place. And then, of course, the personal protective equipment is that last line of defense. And so we have procedures in place in all of our facilities for healthcare professionals to protect themselves.
From City News, Jonas.
For Dr. for Lynette Gusa, the call today for nurses for help, does this include retired folks as well? Are you looking for anyone, or is this active nurses?
Right now it's for active nurses, but we are looking at the possibility of retired nurses as well, but not quite yet, but soon in the future, I think.
And just one as well for Dr. Roussin. The transition in Selkirk, do you believe this health professional got it out of the facility or inside the facility, or has that been determined yet?
Yeah, the investigation suggests that it was related to travel.
Thank you.
From Global, Marnie.
Marnie Blunt from Global Winnipeg. Dr. Roussin, you have said you're not going to release on specifics on healthcare workers, but in other jurisdictions, we have seen regular updates for healthcare workers who have been confirmed with COVID-19. There's been 77 cases involving healthcare workers in Alberta, 91 in Ontario. BC is also confirming healthcare workers. Given what other jurisdictions are doing, why won't Manitoba release that information? And is that something that could be reassessed in the future as the situation progresses?
It can certainly be reassessed. We certainly release it when it has a public health implication. And so just as you saw today, so we'll definitely continue to do that in any information that has relevance to the health of the public. As far as healthcare workers go, that's something that we'll be reviewing on there. We can certainly see that there's healthcare workers who have been diagnosed but may not have been acquired within the healthcare area. So there is that distinction as well. But we'll see looking forward, where you can see as our numbers increase, whether that's something in addition to our usual things we report that we might report on as well. Certainly it's to the people, to our occupational health and safety, infection prevention and control. All these people are all involved in this, so this is quite relevant for the public health practice and investigations. But just releasing to the public, we will do right now when it has a relevance to the health of the public.
And as a follow-up, what can you say to people and members of the public that now have concerns that they might be going into the hospital where a healthcare worker has COVID-19 and doesn't know it yet? What can you say to sort of calm nerves, or what message do you want to get out to the public who have concerns about this?
So a lot of safeguards are in place. Certainly they're not perfect, but we now have a number of restrictions on travel, and especially regarding healthcare workers. Healthcare workers are closely monitoring their symptoms and should report any symptoms immediately to occupational health and safety. And so they're just the typical precautions, right? That protecting ourselves, staying home when we're sick, staying home if we can, lots of hand washing, and our healthcare providers, we're doing whatever we can to protect them, and they are closely monitoring their symptoms. So a lot of safeguards in place. So anyone who needs health care certainly can feel safe to do so. But we want people with mild illness to stay home. People who are unsure, call Health Links, and then certainly those who are feeling quite unwell or need urgent or emergent care can also call Health Links or use the usual processes.
From CJOB, Diane.
Good afternoon. It's Diana Foxwell from CJOB. Dr. Roussin, a former World Health Organization Assistant Director General, told 680 CJOB yesterday that social distancing measures could be in place for at least a year. What is your reaction to that, and do you see that becoming a reality here in Manitoba?
So nobody knows what this virus is going to look like in a couple months here even. We've seen other jurisdictions flatten their curve. We've seen a peak in other jurisdictions and a downtrend. There can sometimes be more than one wave of viruses like this. There's work right now on pharmaceutical interventions. We know that a vaccine is unlikely within a year. So no one really knows what we're looking like. We certainly would not be able to sustain this degree of social distancing strategies for a year. So we need to look at other type of strategies in there. But no one can say. But we do have to expect that this is not a short-term solution. This is going to be for many weeks of this type of intensity. And going forward, we need to still learn what this virus is going to do.
And then as a follow-up, with this new testing site coming to North Winnipeg, you're clearly expanding sort of the capacity, the accessibility for people to go and get tested for COVID-19. Do you have a sense of when you'll be able to expand the criteria for testing, and who might the next kind of populations be who would be able to access those tests?
So again, a lot of that depends on many factors. So I don't have a specific date on when we're going to expand testing further. But really with where we are now, the type of expansion we can do is to symptomatic people who are in higher risk categories regardless of travel. So not just hospital-based patients. And then ultimately, it's the testing of all symptomatic people. But we need to prioritize right now, and we're testing the most at-risk people for COVID-19, and we'll expand that as our capacity increases.
Thank you.
From the Winnipeg Free Press, Carol.
Good afternoon, Dr. Roussin. Where we're at today with the number of positive cases at 103, is that more or less the number of cases that you projected earlier a few weeks ago
It is within the range of our early projections at this stage. And the severity tends to be at the lower end of what our predictions are, but it's quite early right now. So we're continuing to update our models, but this was within things that we were expecting.
And as a follow-up, what's the turnaround time for tests in the north? We're hearing about a positive case that took 6 days to get a result. Does that sound right, or?
It's the turnaround at the lab, depending on the capacity and the need for prioritizing other samples, can be more than the 48 hours. Could be 36 hours, and for lesser ill people sometimes longer. But again, that clock doesn't start ticking until the sample is at the lab. So when you're talking about isolated areas, if it takes 2 days to get the sample to the lab, then that's 2 days plus the turnaround at the lab.
Is it taking 2 days for Dauphin and Flin and places like that?
To get the sample to the lab, I don't know. It depends on which manner they send it.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Doctor, I think this might be a fair way to ask the question without coming close to infringing on anyone's personal privacy. Has there been any evidence yet of a healthcare worker getting a possible or confirmed case in the workplace?
Is that, I mean, certainly in other jurisdictions there are, and we have been investigating some cases where that type of transmission is considered. I can't confirm that, but certainly when we see such cases, it's the investigation will center around that, whether there was it could have been contracted in the workplace. As well as was adequate PPE used at the time. So I can't confirm that there was a confirmed case that spread to a healthcare worker, but we have a lot of investigations ongoing.
Sorry, just double check. You said you can't confirm that, correct?
I can't confirm that at this point, no.
Okay. My follow-up is the case you're highlighting today in Selkirk. You said you believe it appears at this point to be travel-related. Travel-related, as we learned, can be a pretty vague term. It can be the person traveled themselves, or they came in close contact with somebody who had traveled, or maybe it's further down the chain towards somebody who traveled. Did this healthcare worker travel themselves?
Yes.
Or were they in contact with somebody who traveled, and was that in the workplace?
Yeah, it was directly related to travel within Canada.
The person themselves traveled?
Correct.
Okay. Thank you.
From CTV, Michelle.
It's Michelle Gerwin from CTV. You released the days and times that this staff member in Selkirk was at work, but is there any concerns that they also went out in the community as well during that same time? If they were going to work, how do we know they weren't, say, going to the grocery store, those kinds of things?
So that's part of the contact investigation. So all that work has already taken place. And so, again, somebody going to a grocery store is different than being a healthcare worker caring for clients in an ER. Right, so that's where that close, prolonged contact is likely. So that's why we made that announcement. If there was any other venues that this person was at that would put the public at risk, we would announce that as well. But that's all part of the contact investigation.
Okay, I don't have another question. So.
From the Flin Flon Reminder, Cassidy.
Hello. Yes, I'm following up on yesterday's announcement of all non-essential businesses closing. would that apply to a mining work camp that we have one in Snow Lake that's a bit north of us?
Yeah, so typically mining operations are not affected by that order. Any specific business that had questions should go to engagemb.ca and they can get specific advice regarding the order.
Mm-hmm. It seemed like a work camp might be a place where this virus could spread.
Yeah, this virus could spread in a number of places. So all of these orders, all of these actions that we take are a balance, right? So if we looked at ideally, it would be everyone stay home, right? But we can't function that way. There's a lot more. There'll be a greater impact on health if we did that. So we need to ensure that critical services are maintained. We need to have adequate protections for those people in the workplace. So regardless of whether you're named in the order or not, employers, individuals, organizations need to take physical distancing very seriously. And so we've worked with different camps of that to put in processes that limit the risks of this. But this physical distancing, social distancing, you don't need an order to help Manitoba. So all of these things reduce the impact of this virus. It could actually save lives. And so you don't need an order to do that. So I would encourage everyone to be practicing social distancing at all times.
Ladies and gentlemen, we have about 5 minutes left. If anyone has a final couple of questions, go ahead.
Yes,
Josh Olin, Winnipeg Sun. I was wondering, this healthcare worker, especially with nation requirements, why did this person self-isolate for 14 days, or have they isolated for 14 days and then came back with these symptoms after that and allowed to work for another 3 days while exhibiting symptoms?
Yeah, so there's a couple of questions on there. So first is the requirement to self-isolate for 14 days on interprovincial travel came into effect after this person had returned from travel. And so that wasn't in place. How a symptomatic person was working for 3 days, I can't answer that. It's we talk about our strategies, and there's always so much questioning about how much testing we're doing and how many tests did we do yesterday and things. So again, it's the basic things that make the most difference here. Hand washing, social distancing, stay home when you're sick. So it doesn't matter how many tests we run if we have many situations like we saw there. So it just goes in to show that testing is not the focus of our campaign here. It's important, but there's many other much simpler things that we can do to limit the impact of this virus.
Right. This isn't a testing question. If they're exhibiting symptoms as a healthcare worker during a pandemic, what kind of fail-safe should have been in place to make sure that this person was not still working in an emergency room and dealing with medicine with other people around?
Yeah, and that's the policies we've created right from the beginning to avoid situations like this.
All 109 CHCM. I just have a quick question. The order that's set to take place tomorrow, does that include kiosks, the Manitoba Hydro kiosk site at all as well? Are they a part of an essential service?
Yeah, I would encourage any specific site to go to engagemanitoba.ca to look at the order and see if it applies to them. There's a myriad of businesses in the province, so I don't want to speak on each specific one on whether they're included in an aspect of the order or not. So typically there's a list of critical services there. I would encourage any business to go to engagemb.ca to see if the order or a part of the order applies to them.
number of cases that Manitoba has seen so far have been mainly women in their 20s and men in their 60s. Is that just a coincidence? Is there any explanation, or do you have any sort of idea of why that might be?
It's still relatively low numbers, so it's hard to make note of that. We see cases in most age ranges. Some of that might be, certain groups are more likely to attend for testing. Lots of reasons to consider, but I don't think there's much to make about that.
Dr. Roussin or Ms. Sardusa, Brent Roussin, CBC, are the current COVID hospitalizations at the new 30-bed isolation unit at the HSC?
No, they are in isolation. We have the isolation unit ready, but we need more than one patient in there to open it. But they are in a safe place and isolated. And should the need arise where we have a surge, then we're prepared.
Any positive patients from First Nations?
Not from First Nation communities, no.
Are they Indigenous?
I don't have that report on that. I don't think we have an identifier right now on that. So,
thank you, everyone. That concludes today's media briefing.
Thank you.
Thank you.